Hello, Healthcare Experience Matters listeners. We're excited to present today's interview that was actually part of the Healthcare Experience Foundation's virtual certificate program. And we're actually excited to announce that the full slate of these virtual certificate programs has been published. You can take a look at the schedule of upcoming events in the link that's in the description of this podcast episode. These certificate programs deliver practical knowledge and lessons from leaders across a wide spectrum of healthcare disciplines. They use real-world examples and cases and provide opportunities for us all to learn alongside our fellow healthcare professionals in these interactive virtual online cohorts. So please check out the remaining schedule for 2024, and perhaps we will see you there.
And I have the great pleasure of being joined by Dr. Denise Robinson today as our industry expert perspective on this session about healthy conflict and difficult conversations.
Hi, good morning. I'm currently the Vice President and Chief Nursing Officer at Loma University Medical Center and the Murrieta campus in California. I also hold a position as Associate Professor of the Loma University School of Nursing. I am a senior nurse executive with expertise leading all aspects of clinical operation. I demonstrate a lot of experience with evidence-based practice and quality, have a wide range of knowledge in nursing management, quality and patient safety initiatives. I also implemented on my journey a wound care center at the Good Samaritan Hospital. That was one of my passions. I have a background in public health nurse. I spent over 20 years with Visiting Nurse Service of New York, which was a wonderful experience of the outpatient setting, and got a lot of my experience in various roles as a nursing leader and then as a chief nurse executive. My prior job before I came back to Loma Linda, I was a senior vice president, chief nurse exec in Cooperstown at Bassick Medical Center, which was really a great experience. I hold a doctorate of nursing practice degree from Case Western Reserve University and a master's in public health from Columbia University and a BSN from Skidmore College. The journey has been quite interesting. I think you have a passion when you start out as a frontline, I'm going to say frontline, or a new nurse of your goals and aspirations and where you think your niche is. And as you meet nursing leaders and have your powerful chief nursing officers, your direction and your goals can change and become quite different. So my journey is a little unique, but I've had great mentors along the way in my journey that has helped shape and mold my direction. Sometimes you think you're going one way and you meet someone and they take you a different way. And what I can say to everyone in this journey as new leaders is follow your mentors and go through the door of opportunity.
Thank you for that wonderful introduction, Dr. Robinson. In the session we just heard talked about healthy conflict and how it can lead to some positive change. I'd love to hear some of your stories, your own personal stories or thoughts on your experience in this aspect.
Well, as a CNO, the key benefit of sharing my perspective on healthy conflict and having difficult conversations, firstly, would be to foster a more productive and collaborative work environment for all of our nursing teams. It's important for all of your teams and everyone on your team to feel a part of the team. And for us to be able to identify the strengths and weaknesses of all of our leaders and to work in that direction. I think we address the importance of embracing conflict as an opportunity for growth. And that's really important, that the person who you're having a conflict with or is having a conflict, when you're meeting with them, to make sure that they understand that this is an opportunity for growth rather than something to be avoided. So we as nursing leaders try to resolve issues all day without avoiding conflicts. And sometimes that's not the way it goes, right? You're faced with conflict, you got to make difficult decisions. And, sometimes they're not always pleasant, but we encourage open communication and transparency. When nurses feel empowered to have tough discussions, it can lead to a better understanding. It helps them to improve their decision making and stronger working relationships within their own team. I want always for my team and my frontline to know that their voices count. I recently gave my nurses and my frontline and some of my charge nurses, took one from each of our service line and brought them to the table of our nursing leadership meetings so they can hear all of the things that we're working on in our specific swim lanes that they're really probably not exposed to, and that they can bring a voice to the table and ask their questions. So we choose them. I ask the managers and directors, the staff that they're bringing, that they have chosen to join our leadership, that we want it to be a positive experience for growth. We want them to understand how to engage in professional conversations and stay professional. Body language is very important, that we need to always remember that who we are is what they see, and we always want to be a role model. I try to work on promoting a culture of continuous learning and development, offering educational opportunities, and encouraging my nurses always to gain certifications in their specific areas, attending national and global conferences for their growth and their own personal network so they can get out and meet different nurses and going to conferences. You see the people working on the same things you're working on, they're having the same struggles that you're having. It's important to frame conflict as a chance to challenge assumptions and broaden perspectives that can motivate nurses to engage in productive dialogue.
Dr. Robinson, you've been a nursing leader for a long time, and I want you to share with with everyone watching today, how you've become more confident having those difficult conversations, because I think confidence might be a huge, part of this conversation. And also, what have you learned to help you overcome that anxiety that comes along with, that anticipation of a difficult conversation?
Our goal is always in our teams is to be able to be transparent, always be honest, always listen. The key to listening to, there's always two sides to every story. Always come with the facts. Try to gather as many facts as you can before that difficult conversation, and to really give that person some privacy. Do not talk to them in public. Always try to get an area where you can either schedule some time with them and you want to tell them what you want to discuss, to give them an opportunity to be able to formulate their story or what they have to say about that particular conflict. And you want to listen. Listening is the key. You want to be able to listen attentively. You want to make sure that you have gathered yourself, that you're not making, your face doesn't have an opinion, that you stay professional and you stay open and really compassionate and empathetic, because whatever that conflict was, sometimes there's a reason behind it, but you want to make sure that you're giving that person an opportunity to share their viewpoints. Improved patient outcomes should come along with that, because we're here in our hospital in our roles to serve the patients. So we want to make sure that our primary goal is to serve our patients, their families, and the communities that we are in. When nurses can effectively communicate with you and resolve conflicts, it leads to better coordination, fewer errors, high quality of patient care. So this is really important. I wanted to just share a story that happened yesterday. And this is something that we all face when a leader tells you they're leaving, or they give you a letter of resignation and they tell you, that they're going on with family or to promote themselves, which is fine. And you interview for the position and you have a lot of internal candidates. We know when someone's leaving who thinks, there may be managers that we're ready for that next seat. And a conflict came yesterday with one outgoing leader and one leader who is assuming her role, and the outgoing leader changing decisions that was made by the leader who is staying. This leader is supporting us with taking over her service line while we are continuing an interview to replace her. And then I had to deal with that. And, you don't want anyone to think while they're leaving, they're not valued and that you didn't value all the hard work that they did. But having that difficult conversation yesterday, trying to redirect their leadership, going out and be empathetic to the leader, who is trying to take over the role, and having that difficult conversation that we need to talk to each other, find out what we're doing for the day, and trying to be a leader and being a colleague to that person on your exit. So that was a difficult conversation to have both of them in a role, because you really don't want any hurt feelings. And, the person leaving has done tremendous things for the organization. So you don't want to put a cloud over the work, but you really need to have that conversation. So that was yesterday. So this came right on time, just remembering the do's and the don'ts and how you set clear expectations. And sometimes you have to do it like right on the spot. And so take them to a private spot and, give them the benefit of the doubt, and then just make those decisions right then and there. So turned out great, but not always do it turn out where people are really happy to hear your advice on leaving.
Valuable story. Thank you for sharing that. As we wrap up here, let's leave on a high note here. So just give our audience some tips. If they're newly appointed leaders, what advice would you give them about conflict with team members they work with?
Yeah, I think what we need to do first is to check in with yourself to ensure you're emotionally regulated and not triggered by the situation. Take time to get grounded before the conversation. Decide to have the conversation. Don't avoid the issue. I promise you, it does not go away. It can go and get even worse. So I think to recognize you have the ability to produce a high-performing team, but you don't want to leave the elephant in the room. So you really want to address it. I would say practice active listening. Once you state your perspective, step back, allow the person to speak, listen attentively, and get the other person's viewpoint. You can, sometimes get emotional responses, and you want to be prepared for that, but you always want to readdress and remember what outcome that you are trying to receive, because you have scheduled a meeting. So this is important. You have to resolve the conflict. So I think that it is great to have a one-on-one first with the person and not to engage them in a group that never comes out well. And I would say that you need to always be attentive and be present. And you having the ability to be compassionate, you need to just always have clear expectations and be open to making sure that you kind of do that listen back and ask them, what did you hear from this? Is there any questions that you have for me? How can I help you in this situation? And just be a mentor and guiding your leaders and how to be a team player, how to, be a good fit, how to work together in a team, and how everybody is going to have an opinion, but you can respect their opinion and you have the right to disagree professionally. And sometimes in an open group is not the way to disagree with someone. You can always have a sidebar later and have your opinion later. But I think being a part of the team and knowing the team you're on, all for the same goal, trying to achieve the same thing is really, really important. So going with your mission, vision, and values, you can always bring them back. These are the mission and visions of values of the organization. And this is where you want to start your viewpoint from. It has worked well for me. I think I've been in a couple of probably difficult conversations where your boss have asked you, really? What were you thinking? And you have this, kind of go back and like you're trying to think what you did wrong or maybe what you said wrong. But then after, you get a couple of coaching through your career, you learn that sometimes not speaking in certain rooms, we're taught to look at your room, know your room, who's in your room. And I think for new leaders, listen to advice of someone who's been in the organization as a positive role model is great. You have your chain of command, use it. It's very helpful. If you have any policy questions or anything, you can ask your HR. You can ask your CNO. I know all of my CNOs had an open door policy. My door is always open. I have a CNO meet and greet every single month. So every new employee that comes through meets with me up in our suite. And I introduce myself. I give them my cell number. I expect them to use it. Let me help you on your journey. Let me help you professionally. Let me help you achieve your professional aspirations and whatever it is you'd like to gain on this journey. So my last, comment to all of the new leaders, continue to be who you are and don't be not transparent, because we have all generations now working, the Gen Zs, the Gen X, and the Gen everybody's. We have, multi-generationals in our specific swim lanes. Everybody has a different way to communicate. Some like text, some like email, some only like, whatever they communicate with. And so just being a part of that and not always taking ourselves so seriously, and just to reframe conflict as a natural part of teamwork and equip yourself and your team with the skills to address it productively. By doing so, you can turn conflicts into a catalyst for growth and improved performance.
You've been listening to Dr. Denise Robinson. She is the Chief Nursing Officer for Loma Linda University Medical Center, Murrieta. Thank you so much for your time today.